Hi, my name is Carol Weaver, and welcome to a segment of Cosmic Weavers Consulting, October 7th, 2020. And today we were going to talk about the difference between life coaching and therapy. Life coaching is becoming a new term that people are now becoming familiar with. A lot of people have questions about it. They want to know the difference between going to a life coach versus going to a therapist. What are the advantages or disadvantages? So I'm going to talk about that. I'm personally in my career in becoming a life coach. I've been certified 2 weeks ago. And so to start off in my career, I thought I would serve the audience by explaining what life coaching is and what is the difference between life coaching and traditional therapy. Okay, so first of all, therapy, to become a therapist, you have to have 4 years of undergraduate studies, followed by 2 years in the master's program. In an undergraduate study, often a student takes classes in psychology and or social work and or rehabilitation counseling / therapy. And then when they go on and when they go on and get their master's degree to become certified as a therapist, there's mainly those three ways. You either become a rehabilitation counselor, or you become a psychologist, or you become a social worker specialized in therapy counseling. Okay. And then before you get certified, you must, the studies include, in the graduate studies program, it includes 1,000 hours of clinical practice. So you spend a lot of time practicing in a graduate program on communications, how to communicate with patients. A lot of times, students in the graduate program will work with psychiatrists and people with doctorate degrees, and it's a very clinical pursuit. And you'll oftentimes deal with patients that have medical issues. They have mental illness issues that's based in imbalances in the brain, and often patients that receive services from social workers and psychologists and even rehabilitation counselors are on medications to help with balancing the brain with those issues, So populations of people that are worked with, by psychologists or with psychologists, rehabilitation counselors, and social workers often are people that have depression, medically based depression, severe. They might have some bipolar issues, or either they have schizophrenia or mild symptoms of delusions and require behavior management and medication. So that gives you an idea. So the difference that is marked here is psychologists, social workers, and counselors, rehabilitation counselors work with people that have an understanding of medical issues that deal with the brain and work with the diagnostic manual for the DSM-3 or 5. Now it's a 5. So, life coaching. Now we're going to talk about life coaching. We'll still do a little comparison. And by the way, psychologists, social workers, and rehabilitation counselors have to go on and study for their exams, and they have to become certified. And that's kind of a lengthy process. Now, life coaching, on the other hand, many practitioners that have been doing life coaching for some years oftentimes have started their careers working as mental health practitioners in some way or another, teaching classes that is about self-improvement, or it's about anger management. They work with people in special populations. So yes, a lot of uh, practitioners have histories where they've worked with patients with mental illness, such as schizophrenia, depression, bipolar disorder, you name it. Other populations that life coaches may have worked with in the past are people that may have had autism, or they're students in schools under special education programs. That's another example. Developmental disability is another area that oftentimes life coaches have experience with at some point in their career. I've had experience in all three of those areas. I've worked with people with mental illness. I've worked with people in the elderly population. I've worked with adolescents. I've worked with, children, smaller children, and average adults, and in special education as well. So I have a lot of teaching background, and I have a lot of background teaching skills that have to do with, developing independent living skills, or have to do with improving life or quality of life. Life coaching has to do with or teaching any subjects to patients or clients about any variety of subjects that have to do with managing your life or improving your life or dealing with your special conditions and learning to adjust to society, what have you. How to tailor your skills in the job market under certain circumstances or limitations, as often is the case with people with developmental disabilities. And so many of these individuals who are life coaches pursued a career in life coaching because they already have a lot of experience in teaching and promoting skills that have to do with increasing the quality of life. And that's what life coaching in essence is about. Both social workers and life coaches especially are concerned with developing action plans with the client to improve specific areas in life that is causing the client discomfort or sense of dissatisfaction. Generally, a lot of people may come to therapy because they're dissatisfied with their career, they want to change of jobs, or they're in a relationship and they're unhappy and they don't know why, and they want to explore that, and they want to make some small changes in their life that may just beef up the quality of their life. It's a very practical approach to solving problems. Psychological counseling often involves going back into the history of the patient, the client, to their childhood, and spending some time there talking about how patterns or behaviors may affect a person in the current situation, and then taking a look back there, learning how to change patterns, or to change emotions, or change perceptions. And life coaching does the same thing. They just don't work under psychiatrists or doctors or psychologists. They don't deal with medical issues. They just deal with, a client's issues that they bring to the table, and wanting or having a desire to improve their life. It's either in career, it could be in relationships, it could be about where they live, it could be about their sexual orientation and how to deal with that. They're just different things and different issues that people have about that. So I hope that brings some clarity to what some of the differences are between, say, getting psychological counseling, getting life coaching. So that is something to look at if you're wanting to pursue counseling. What is the best path for you? And it may not be necessary to go see a psychologist or a therapist. Logistically, there are a lot of, insurance companies oftentimes will pick up a portion of the expense of going to therapy. whether it be a social worker, licensed social worker, or a psychologist or a psychiatrist. Um, and medical insurance will pick up like 80% of whatever it costs to go see a therapist. Life coaching, on the other hand, that doesn't happen. Medical insurance companies do not pick up, and doesn't cover life coaching. So a lot of times people will go to life coaches because it's much more practical. The commitment of the contract is much shorter, so maybe you'll only need to spend 5 sessions with a life coach, $50 a session, and then with an action plan you're able to successfully make changes in your life or in that area of your life that's causing you discomfort or a sense of dissatisfaction. So that might be the way to go. Psychotherapy, on the other hand, sometimes it takes, depending upon what types of issues you have. If you have a mental illness, it does require, a lot of times having a mental illness, when you seek out a therapist, it takes more than 6 months to a year or even longer to implement a plan in managing illnesses, and quite successfully. And so life coaches are not equipped to handle these types of problems. So you have to know that off the bat. And when I would be having an initial consultation with a patient, I would be doing a quick inventory if there's a history of mental illness and whether or not they might not be better serviced by a psychologist or a licensed therapist. Okay. Then we'll move on. We can talk about one other aspect of life coaching that is similar to psychologist training and therapist training is life coaches have a lot of experience in communication most of the time, not all the time, but most of the time. Life coaches have a career history of having teaching experience, counseling experience, teaching life skills like dialectic behavior thinking, cognitive behavior therapy, acceptance commitment therapy, different forms of models of teaching, ways of thinking to change perception or to come up with an action plan and change an area of your life. That's similar to therapy. Because like I said, a lot of life coaches have had experience in teaching many hours, over 1,000 hours. It's not considered clinical hours, but nonetheless, it counts just as much, just because of the level of experience or the time spent in institutions, hospitals, schools, working under psychiatrists or working under social workers, implementing programs for patients under the guidance of social workers, psychiatrists, mental coordinators, etc. Okay, so the last and final thing that I want to discuss about life coaches, just like psychologists and psychiatrists and rehabilitation counselors might specialize in an area, and this is very true of psychologists and licensed therapists. They may choose to specialize in divorce counseling or marriage counseling, family counseling, group counseling, adolescent counseling, specific problems with the adolescent population, gender issues, sex orientation or sexual orientation issues, drug and alcohol counseling. These are areas that psychotherapists will specialize in as they go along in their career. And some of them don't. Some of them specialize in several areas. Life coaches are similar in that regard. They may choose to specialize in relationships, so they're called relationship life coaches. Other life coaches want to focus on group relationship So they might have several couples come to a group, and they do group therapy with married couples, more than one, or sometimes they'll just specialize in just counseling with one married couple at a time. Um, Self-improvement. There are life coaches that specialize in self-improvement, whether it be career, it could be in the sector of careers. A lot of people, I forget what the percentage of people in America, I think it was something like 60% of people in the workforce at one time or other think about changing their careers. So seeing a career life coach might be the way to go. Another area of specialization is spiritual life coaching, which is more like what I do, because it covers areas of career, relationships, in your personal life. I use the term spiritual life coaching / life purpose coaching because for me they kind of go together, you know. So there you have it. If you have any questions, please comment on my video. I will answer your questions, and I will be putting out another segment about life coaching. And check out my website at www.theweaverstarot.com. On there you will see the Cosmic Weavers Consulting. If you have any questions or comments, please feel free to leave them. I posted a couple blogs. One is about the role of humor and how it enhances the quality, life and makes things a little easier. And another video that I posted, I don't even remember offhand, but it's a good one too. So thank you very much for watching my video, and I'll look forward to posting more about life coaching. And look for my other videos on tarot. So we'll be doing weekly tarots as well, tarot readings. Thank you again, and have a blessed evening.